Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with bilateral occluding crusted dry skin. As you can see, they are a hearing aid wearer. So one of the potential causes for this keratin buildup is the hearing aid preventing the natural migration of skin out of the ear. So once upon a time, this skin that I'm removing now was lining the patient's ear canal and eardrum. And after a while, that skin begins to shed, and it should migrate sideways from the deepest part of the ear canal to the entrance, where it's eventually expelled via jaw movements. And when you wear a hearing aid, you're of course blocking that natural migration route. So the patient never really had any problems with dead skin or earwax prior to wearing hearing aids. So it is one of the things that can happen when you wear hearing aids. But of course, if you've got a hearing loss, we want you to wear hearing aids, and you just have to have your ears clean on a regular basis if you're one of those people that then develop a wax or keratin buildup. So I've just used some medical grade olive oil, and you can just see the clarity of the skin. You can see how glossy it is. You can probably see the texture. It's really dry as well and crusted. So I'm just slowly wriggling this out. With skin like this, sometimes the surface is almost like sandpaper. It's really rough, and as you're removing it, patients sometimes can feel it's a bit uncomfortable because it's rubbing against the side of the ear canal. This patient didn't, but it is a possibility with this consistency that patients do find it, I wouldn't say painful, but it's slightly uncomfortable. They notice it's there. The oil does help because of course it helps to soften it. So this is just at the base of the ear canal. I just want to make sure there's nothing sinister, like a canal cholesteatoma hiding underneath that. Quite often with canal cholesteatomas, they are well hidden by a blanket of skin, and it's only when you peel that layer of skin away that it reveals an ulceration and some exposed bone. Normally, however, the skin is a bit more damp in that region because it's discharge. That was dry and crusted, so it's not going to be a problem. There is a little bit of dry keratin right on the centre of the eardrum. That's where all the skin originates from, that line between the two thirds of the ear canal, but it's not going to cause a problem, so I just left that there. I'm just mopping up near the entrance. This is where the patient inserts the hearing aids, in this region, and they did report having to maintain the hearing aids more than regular recently. So the hearing aids this patient's got, actually the main unit, the processing unit is behind the ear and the microphone, and you have what we call a receiver and canal. There's a speaker that goes into the ear, and that connects to the hearing aid via a wire concealed in a thin tube. And at the end of the speaker, you can either have a custom mold made, which is what this patient's got, or you can have a generic dome. And there's various different types of domes with different acoustic properties depending upon your hearing loss. So this patient had a custom mold, and so when you've got wax and skin lateral like this, when you insert the hearing aid, some of this dry skin and wax can enter the sound bore, so basically where the sound is amplified from the speaker into the ear. And there is a little wax trap there, a little wax filter, which is almost like a tennis racket head or sieve. It just stops the wax from entering inside the speaker, the electronics, and then that filter is replaceable. Now this is their right, it's a bit more narrower. If you notice on the left hand side, the first bend, so I'm just using the left hand side of the specular. We can just see on screen to just stretch this patient's entrance open so I can gain access. A bit more skin here laterally, because that's why it's really reflective. I did already turn the exposure down. I could have turned it down a little bit more for that piece, but it wasn't really hindering me. And once I remove that, you can see the reflections far less. So this is just past the first bend. I can just see the second bend to the right there, the piece of flesh. That's the second bend. And I'm just pulling this out. Just came away in smaller pieces. So it wasn't getting suctioned up the tube because of the consistency. So I'm just put some medical grade olive oil spray in, just adjusted the focus, and again I'm just peeling this down. You can see the fresher layer of skin that's shed on the outer side, the more reflective piece, and on the underside the skin has been there for longer So it's kind of shedding in layers. So the deeper wax is more oxidized, so hence why it's a darker colour. So again, I'm just stretching that first bend open. I'm using our medium-sized specular, by the way. It's 4.25mm. We have got a smaller one and two larger sizes as well. And this is where the WAXscope, or any method with a specular, some people struggle with an endoscope to stretch the ear open. But when you've got a speculum attached, it is a bit easier to do so. But then whenever you have a specular, your view is obviously more narrowed, and any visualization device with a specular, the camera is, or the lens is external, it's not in the ear like an endoscope, so you get a more narrowed field of view. So just remove that final piece of skin. I'm just going to stretch the ear open. I'm going to push the speculum through just to really dilate it so we can have a full clear visual of the eardrum. Look at that, crystal clear. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.